Good morning, everyone. My name is Pierre, and I'll be going over PTSD, who suffers from it, and why do people get it. PTSD is a mental health problem that is caused by the inability to recover after experiencing or witnessing a traumatic or terrifying event. Anyone can be affected from post-traumatic disorder. Kids, adults, after having experienced a traumatic event. Kids coming from abusive family, or adults after coming from war. Most people affected with PTSD will develop feelings of anger, extreme anxiety, guilt, sadness, fear, and mostly shock. All these type of different feelings will also affect their family members, their kids, their spouses, and individual with PTSD will feel detached from their friends and families. If not treated, it can lead to depression and suicide. Individuals who suffer from certain mental illness or anxiety will be at higher risk when it comes to developing PTSD. People who are prone to suffering from depression based on their family and genes, or at high risk of suffering from PTSD. Some facts about PTSD. It is estimated that about 7.8% of Americans will suffer from PTSD in their lives. About 3.6% of adults suffer from PTSD during the course of a year. At least 30% of individuals who have experienced war zone suffer from PTSD. Individuals who served in Iraq who suffered from PTSD range from 15 to 20%, which is a very high number. Individuals who served in Afghanistan who suffered from PTSD range from 5 to 11%. Thank you.
Hi, I'm Courtney Argo, and we are now going to talk about how you can help prevent the symptoms for PTSD. I'm going to show you a video on why pets are really good for you.
My name is Casey Romero. I am a Navy veteran and the proud owner of Jazzy. I was an aviation ordnanceman, so I worked around bombs and missiles and bullets, and I got out about 8 years ago. I had just been diagnosed with PTSD, and sometimes I would be afraid, and I kind of felt like I was in a shell. I needed a battle buddy, somebody that's going to be there for me, and honestly, there's no better option than a dog.
My name is Clarissa Black, and I'm the founder and executive director of Pets for Vets. Pets for Vets is a national nonprofit, and we rescue shelter dogs and match them with returning veterans to help with post-traumatic stress disorder, traumatic brain injury, anxiety, and depression. One of the unique aspects of Pets for Vets is that our dogs are rescue dogs. They're from shelters or from rescue groups, and I think that it's so important for the veterans because they've gone through so much, and they have this kinship with the dog that they're getting paired with. They feel like they can now provide that protection, and they have that companionship. I actually had one veteran, he said to me, if they can heal, we can heal.
Before Jazzy, it was a little different. I didn't have the same strength that I have nowadays. And Pets for Vets does an incredible job matching the symptoms a vet might have with a dog that I'm so grateful for.
One of the unique aspects of Pets for Vets is the matchmaking process. And so this isn't a cookie cutter program or a one size fits all, any dog is going to work. It's actually the right dog. And so it really takes skilled trainers who understand how to figure out what that veteran is looking for, what they need, and what's going to kind of bring out the best for each veteran. One veteran didn't let me know that he had nightmares, but one day he called me and he said, you know what, I was having a really bad night terror, and she woke me up, she stood over me until I calmed down. And it was just, that was one of those moments where, like, this is why we do this.
She boosted my confidence to get married and have a daughter. Now I feel like I can overcome anything. I feel like when there's fireworks going on, I feel safe. When I feel lonely, I have my buddy right there for me.
I think it's one of those programs that everybody can get on board with, and we're rescuing shelter dogs and we're helping veterans, and it's a win-win. It's two ways to be able to make a difference.
My bond with Jazzy is incredible. When I come home from work, she's always there at the door waiting for me. And it feels, honestly, when I see her, when I open that door, it feels like I just got home from a deployment. And she's my best friend. She's my battle buddy. People ask me questions about her, where I got her from, and it's really nice that I can tell them about Pets for Vets. Anything that helps out veterans. We really don't have much help out there. Bringing a companion to a veteran into their home and changing their lives, it's priceless. Jazzy, she makes me feel secure, confident. She makes me feel like I can conquer the world.
That was just a brief overview on what pets can do for veterans with PTSD. So we're going to dive in a little bit deeper on the benefits of a pet and how they can help with your PTSD symptoms. Pet ownership can provide a number of potential benefits for veterans. The benefits include stress reduction, companionship, increasing physical activity, and decreasing loneliness and depression. It is estimated that 20% of veterans returning from Afghanistan and Iraq have PTSD and/or depression. The percentage of veterans suffering from incapacitating symptoms such as severe social anxiety, flashback nightmares, and hypervigilance is much higher. Pets can offer physical and emotional benefits. Dogs can be great pets. Having a dog as a pet can benefit anyone who likes dogs, including people with PTSD, and especially for veterans. What dogs can do for you: help bring out feelings of love, make good companions, take orders when they are well trained, be fun and help reduce stress, and are a good reason to get out of the house, spend time outdoors, and meet new people. The emotional benefits of pet ownership can be just as good as a human friendship. They increase self-esteem, increase a sense of belonging, assist with depression, anxiety, and stress. Social benefits include companionship, promoting a general feeling of well-being, decrease feelings of loneliness and isolation, and give a sense of fulfillment of taking care of a pet. We are now going to start talking about the medical therapy options for PTSD in veterans.
Hi everyone, my name is Agatha Ahokana. I shall be speaking on medical treatment for PTSD. There are basically 3 classes of medication for this disorder. First is SSRI, selective serotonin reuptake. This class of medication functions by modifying the information taken from the environment by this population. They decrease fear, anxiety, impulsiveness, and suicidal thoughts. Then we have the mood stabilizers. Mood stabilizers work by preventing reoccurrence of depressive episodes. Also, we have the antipsychotics. Antipsychotics prevent agitation and dissociation. But when you combine the SSRI and the antipsychotics, they function better in management of PTSD. Thank you, everyone.
Hi, I'm Stephanie Carrico, and I'm going to be going over the different types of therapies and counseling that a person with PTSD can get. The Department of Veteran Affairs website actually shows all the different methods that can be used to help with treatment of PTSD. It also shows you in a detailed way, like what the therapy consists of and how long it's going to take. And so you kind of go through those and look at them and pick out kind of which one you think is best for you, and then get in touch with a professional. Therapy can be used in place or in conjunction with prescription drugs. These forms of therapy involve talking about the source of the problem and the event that was traumatic and that the individual is having trouble processing. So one of the most popular forms of therapy is a behavioral therapy that's called cognitive processing therapy. This therapy is usually usually done with patients with PTSD. In this type of therapy, it takes you through the event that you're having trouble processing, and it makes sure it kind of takes your brain and rewires it to think about the trauma differently. So some people blame themselves and think they could have changed things and that the outcome would be different. But this will help you think about the events differently so you don't have the guilt that's associated with PTSD, and the trauma that's associated with it will kind of fade away. So this type of therapy involves 12 sessions, and each session is 30 minutes long. So you'll go for 12 weeks in a consecutive weeks. So this type of therapy can be done with a professional on a one-on-one basis, or you can do it in a group setting, whichever one you prefer. Another type of therapy is prolonged exposure therapy, and it's also a form of behavioral therapy. And it involves looking at the event that occurred and everything that you're repressing about the event. So a lot of times people with PTSD, they try to block out like the main trigger and the most traumatic parts of the event and try not to think about it. So their brain kind of puts it away. But this is actually worse for them to do. And talking about it and getting it out in the open will actually help them get over it. So sometimes people don't want to relive the event, but if they do and they talk through it, it can help relieve the symptoms. So this type of therapy makes you face your fears and the events that occurred head on. With this type of therapy, you'll work with a professional, and that professional may make you write down everything that happened in a very detailed manner, or they may make you talk about it, or they may make you watch like a video that goes along with what happened to you, or they may actually take you back to the place that this trauma occurred. So you are actually going to relive this drama, and you do it over and over and over. So it's kind of like facing your fears. Once you've done it so many times, it's not as scary. That's kind of the understanding behind this therapy, this form of therapy. So another form is stress inoculation therapy. And this type of therapy helps deal with stress in a person's everyday life. Stress for a person with PTSD can be worse than a person without PTSD who's going through everyday stress. So you don't want that stress from everyday life to trigger even more things. So it helps not only with the trauma that caused the PTSD in the first place, but with just stress in general. And it'll give you skills that can help you deal with this stress and help you in other stressful situations. So another form of therapy that's kind of controversial is eye movement desensitization and reprocessing therapy. So this is a form of psychotherapy. And this type of therapy is not used as often. It's almost like hypnosis. You will work with a professional, and what they will do is you will sit down, you will find what the main trigger is of this trauma and what you're having trouble getting over, and that's what you're going to talk about. And you're going to talk about it in 30-second intervals. And while you're doing that, they may have like an object swinging, or the professional just may move their hand back and forth during that 30 seconds while you're talking about it. And it's supposed to be a relaxation technique to where you'll do it for 30 seconds, and then you'll discuss how you felt during that 30 seconds, and then you'll take some time and you'll do it again. And this you'll do every week as well, until you're very relaxed and almost comfortable with the trauma. You're not stressed out about it anymore. So another form is group therapy, and group therapy is an option. Some people don't want to talk about the problems in a group, and some people do. So you have that option of one-on-one or group therapy. Some people like group therapy because it's nice to know that other people are going through what you've gone through, and it may not be the same situation, but a lot of people feel like nobody understands, nobody knows what they're feeling. So this can kind of give them a little bit of help in that situation. You may find someone you're more comfortable talking with. So talking about the events that led to a person's PTSD can really help. in dealing with the stress that comes along with it. And it can help, all these therapies can help with the coping and just helping to get their lives back in order to where they want to be. But overall, you have the option of picking whichever therapy you are most comfortable with, and you can talk to a professional and see which one would be best for you. A lot of people choose the cognitive processing therapy because it's more just talking and working through it, but other people choose the other things. But the stress inoculation therapy is probably good for a majority of people, just to help with the overall stress of daily living. So thank you.